I'm used to taking care of people who are struggling, but sometimes I feel like I can't do it anymore.
Some days are better than others. Today I felt anxious and nervous, and I couldn't stop thinking about my patient's suffering.
Am I even making a difference? After what he went through, I don't know if I can help at all. Maybe I should find another line of work.
She was so distraught, I couldn't take away her pain. I was absolutely exhausted after seeing her.
These are the voices of compassion fatigue. It can happen to anyone, but the people who seem to be most at risk are those medical and mental health providers who care, day after day, for patients who are struggling with significant symptoms. Compassion fatigue is not burnout, and it is not simply overwork. It is defined as absorbing the patient's suffering through the experience of taking care of that person. As a provider, empathy might be your most valued skill. It is also the same trait that can make you vulnerable to the experiences of your patients. And you might find yourself suddenly feeling exhausted, frustrated, or sad. Thoughts and feelings might become overwhelming, cognitive abilities can be impaired, and you might feel completely lost where you used to feel the most confident. Providers are especially vulnerable when they are busy in their clinics or hospital schedules and find themselves prioritizing their patients over their self-care and connection with others. Any provider who cares for people with trauma histories can be at risk for compassion fatigue. Providers can protect themselves and build resilience by keeping a few simple things in mind. Be with other professionals. Social support among colleagues is a protective factor for providers. It allows you to feel connected with peers, as well as seek consultation or supervision, or even just the chance to vent in a professional and appropriate outlet. Isolation is a risk factor and a warning sign for compassion fatigue, and staying connected reduces its likelihood and severity. Choose optimism. An optimistic outlook is protective against compassion fatigue, as well as many stress-related health consequences. One exercise that promotes optimism is writing a gratitude log. Once a day, write down 3 things to be grateful for. It works. Make time for self-care. In a busy office, clinic, or hospital, you may only have 5 free minutes at a time. Use those minutes wisely to care for yourself. Everyone's favorite activities are different. You might feel best when you listen to music, journal, meditate for a few minutes, pray, or read. Any of these and others can protect you from the effects of difficult work. Compassion fatigue is a risk for any medical or mental health provider and affects the ability to provide outstanding care to your patients. Providers can be protected from the effects of this experience by putting a few simple practices in their day-to-day routines. The work is so important, and self-care is a priority. It's just good practice.